for a small business, my husband and I could not afford it. It was just too out there. On top of the fact that even with the premiums and the deductions, either they wouldn't take the insurance because it was, they don't get, it just is too expensive for them, and or the deductibles would be too high. And I came across a video, and my husband says, "Oh, it was a coincidence." I said, "No. In Hebrew, there is no word that says that there's that identifies the word a coincidence. There is no coincidence."
That's right.
I think that was something that was definitely divine. And so I saw the video, and I said, "No, there's no way. I ran a hospital for years. I know there's no way this can be done." So I told my husband, I said, "I'm going to go across town. I'm going to go visit this clinic. I'm going to find out what they're doing." A couple of weeks later, I met with Dr. Roger. I did some consulting for him, and then finally he just looked at me and says, "Can you just come in and work for me?" So this is 4 years later, and I'm still here. So it really resonated with me as far as the care that they gave there, the vision and the mission that he has for the organization is not just his vision. We, as employees of his, feel the same way. That's why we're here. And so we want to be able to meet the needs of our patients and try to find the most cost-effective way. And it's, to be quite honest, it's kind of fun to be able to navigate the system that we know very well as healthcare providers, and be able to find options for your employees and for your dependents and for yourselves and your families. So as far as the industry with a clinic, it is definitely unique, and I think it's the wave of the future. And so much has occurred in the last 4 years. Initially, when we started the clinic, it was very basic what we could do in the clinic. And now we have been able to build on that and be able to offer more services and be able to try again still to keep the cost down for employees and for the employers so that they use it. Now that was one of the things that was really interesting when I came to work for Dr. Roger, was that it was the opposite of what you usually would see in a clinic. And that's, they come to you when they're sick, and so they have 60 patients coming through the door all in one day. Well, this was different. They had a membership, and a lot of these people had never even gone for healthcare, period, so they wouldn't use it. So I said, "Oh no, we're gonna figure this one out." We went out to them, right? We went out to you guys, we went out to several of you guys to try to encourage and to help educate and to try to take away a little bit of the scariness of going to see the doctor, especially if you've never seen a doctor. We were able to detect a lot of things. We are working a lot with restaurants, and those are younger population, but you'd be surprised the stuff we have found. And we've been able to tackle it and be able to get them back on the right road. And these guys, they didn't know. They're in their 20s, in their 30s, and they were ticking time bombs. So it's exciting to be able to go out to people and do outreach to our own membership to help educate and get them comfortable calling us or texting us or coming to the clinic. And sometimes we see people 3 and 4 times in a week, and it's like, well, what is this? Why are you coming around so often? But they've gotten to the point where they're very, very comfortable, and they know they can access health care with us, and so it's made a huge difference.